born and all those openings close up. The fetal shunts close up. We want to see this. We want the baby's heart to beat like ours. Okay. The reason that newborn intensive care exists is because they don't always close properly, and we don't always have normal cardiac function. Oh, speaking of cardiac function, did everybody get the link to the cardiac files? Yes?
Oh, yes, yes.
Oh, yes? Okay. All right. Anyways, I'm not going to cover cardiac circulation. You guys know this, right? Okay. Fetal circulation. The pressure in the fetal vasculatures. This means that you want high pressures or high resistance to exist in areas of the baby's body where you don't want blood to circulate to. We said that, right? Since we don't want blood to go to the lungs yet, pulmonary resistance is high. We do want blood to go to the placenta and systemic diffusion, so that resistance is low. Pressure follows the path of the resistance. Okay, normal shunts in the fetus. Perennial valley is between the left and right atria. You have a question? Left and right atria, and it bypasses the lung. Ductus arteriosus also bypasses the lung. Connection between the right ventricle and the aorta. Okay? Ductus venosus bypasses the liver. Okay, here we are. That's not a good one for teaching right now. I need you guys to get some more experience before I show you on this one. This is a good one. Yeah, that's a good one. That's an even better one. Okay. You guys all have it. Okay. We're gonna do this again. The placenta is right here, the blood is already oxygenated. Right? Since the blood is already oxygenated, do we want the lungs to work right now?
No,
They're developing. Right? They're developing. Okay? They're not gonna be ready to go until 27 weeks, right? Lung development period 6 to 27. Yep, okay. In the meantime, we don't want blood to go here. So pulmonary resistance should be high. Does everyone understand why pulmonary resistance is high?
Yeah.
Yes.
Because you don't get blood to the
You want to bypass the lungs. Okay, so that will be via pulmonary shunt, which is this. Ductus arteriosus is pulmonary shunt. Foraminal valley, also a pulmonary shunt. Yes? Okay. We do want blood to go where? Where? Systemic and where else?
In the placenta. In the
And
placenta.
the placenta. The placenta is right here. In fact, I'll show you. Placenta is right here. Okay? Placenta. This is the placenta. We want resistance in the placenta to be low. Why?
When you go there. One go there.
You want blood to go there?
Yeah.
Yes. The blood is going there via the umbilical arteries. Everybody understand that? See the purple? Why is that purple? Because we used up all the oxygen. It's going back to mom. Yes?
Yes.
The umbilical arteries take deoxygenated blood from the fetus back to mom. Do not be confused on that. All of your training says arteries take blood to mom. Yes? Or to your body, I'm sorry. All of your training says that arteries take blood to the body. With the fetus, the umbilical arteries take deoxygenated blood from the fetus back to the placenta. Is everybody clear on that? We're going to cover that today. Okay? So these little purple guys here, the umbilical arteries, are taking blood back to the placenta. Here, fluid and oxygen from the mother. Bright red. That's an umbilical vein. Okay? Bright red. Vein is taking blood to the baby. It's reversed. In the fetus, it's reversed. Okay. Ductus venosus. This is a shunt from the liver. A shunt from the liver. So the ductus venosus bypasses the liver, and blood then goes to, let's go to the other slide. So here's your liver. This is your umbilical vein. This is your liver. Ductus venosus is a shunt past the liver. So the blood goes umbilical vein, ductus venosus, inferior vena cava. All oxygenated blood. inferior vena cava. Where is the what?
Right atrium.
Right atrium. You're crossing a pulmonary shunt right now. What's it called? Foraminal valley. The blood now is oxygenated still, continues on to the,
Left atrium.
goes through a valve called, also called, which one? Bicuspid.
Bicuspid.
Right. This is the ventricle. Left ventricle. Valve.
Aortic.
Aortic valve.
Baby's brain.
Aorta. Brain's up here. Brain gets it first. Okay? Brain is oxygenated. Once the brain gets circulation, now the blood comes back down the inferior vena cava into this chamber again. Is everybody following me? This is what?
Right atrium.
Again, through a vein called, I'm sorry, through a valve called,
Tricuspid.
into a ventricle,
Right ventricle.
valve,
Pulmonic.
pulmonic valve,
Pulmonic valve.
pulmonic valve. This is called
Pulmonary artery.
pulmonary artery. We're going down towards something here. What are we going toward?
Ductus arteriosus.
Ductus arteriosus. Stop right here. Arrow going here, arrow going here. These arrows are taking blood to the lung, but the resistance in the lung is high. Yes?
Yes.
It's not gonna go. You will get approximately 10%. Why? Because this is very congested. There's a lot of blood right here. 85 to 90% goes across the ductus arteriosus and gets into the aorta to feed the lower portions of the fetus's body. Okay? So let's continue from the pulmonary artery, ductus arteriosus, descending aorta. Now every artery that comes off of the aorta feeds blood to an organ in the baby's body. Renal artery feeds what? Kidneys. Okay? So just keep going down. Every organ in that baby's thorax has a branch from the aorta that gets blood supply. By the time the blood gets to the descending aorta, all of the organs have been fed, all of the oxygen has been used up. We're ready to dump deoxygenated blood back into the baby's umbilical arteries. That goes back to the placenta, back to mom. That's why this is all purple, because this is deoxygenated blood going back to mom, waste from the fetus going back to mom. Mom is going to breathe in, blow out the baby's CO2, blow out her own CO2, pull in her own oxygen, make everything bright red again, come back, start over, go back to the little guy again. Yeah? Okay. Now that's an easy chart, right? Yeah? That's an easy chart. Placenta, umbilical vein, ductus venosus. If you read this chart and you study it this way and you can, please add the valves. Does everyone understand? When you do fetal circulation, please add the valves. The valves are not written on these charts. Okay? Add the valves. You will need to know fetal circulation for your first exam, which should be somewhere around September 20 to 26. But we'll know 2 weeks ahead. Alright? We'll know 2 weeks ahead. Yes? Questions so far? Yeah? Okay. Tell me your name.
Damien.
Damien. You're Damien. Okay, Damien. Okay. All right. Damien, I want you to speak up for me, and I want you to tell me how the blood circulates structure to structure from the placenta to the baby, back to the placenta.
All right. From the placenta.
To the baby, and back to the placenta. Do not miss a valve. Do not miss a structure.
Not one. Let me pull out my cheat sheet.
No, no.
No, go from the placenta